So what about gender bias in nurse evaluations of residents in OBGYN? This was a study done on the inpatient wards where they reviewed the nursing evaluations of OB-GYN residents. They had about 2,000 evaluations. 82% of the evaluations were from women, which probably represents the ratio of women to men in residency programs currently. And when they looked at the evaluations and they compared for first year, second year, and fourth year residents, women consistently had lower nursing evaluations than the male residents. And they also found, particularly for the more junior residents, that women got fewer positive comments, so 17% versus 40%, and more negative comments, 17 versus 3, than their male counterparts. And I want you to look at the second half of the table, because when they looked at those junior women doctors, the positive comments that they had less of were competent, thorough, quick learner, confident, hardworking, efficient, inquisitive, achievement-oriented, professional, task-oriented, and effective. So those words were significantly more likely to use to describe men than women. Similarly, nurses were more likely to describe women residents as weak, timid, unassertive, insecure, passive, indecisive, unproductive, lazy, not ambitious, not self-directed, unmotivated, and not curious. So from the time that these residents are walking into the wards, they're already having some implicit biases placed on them by the other healthcare staff that they're working with. So people are clever. So this was a study where they just wanted to look at the influence of gender on how strong surgical residency applicants' letters of recommendations were. So basically think about that. These are medical students who are having letters written to apply to general surgery residencies. And so they looked at letters written from 2016 to 2017, and there were 322 letters that they included for 89 separate applicants. About half of them were women and half of them were men. Most of the letter writers, 86%, were male, about 21% were chairs, and about 50% were full professors. The very first thing they did was just do a word count and say, like, are the letters written for men and women of similar lengths? And they found that the letters written by the male professors, which is basically what they were longer for the male medical students than they were for the female medical students. And then they just looked for types of words that jumped out. And the letters written for the male medical students, they had significantly more standout adjectives, exceptional, or more likely to reference awards that the medical students had achieved. They described their achievements. They described their abilities. If they had any hardships, they mentioned the hardships. And they used words like leadership and gave examples of where they had been involved in leadership. They talked about their scholarship. And this one just blew my mind. And they were more likely to put the applicant's name and use it repeatedly through the letter. So instead of writing he, they wrote Dr. Gillingham, Dr. Gillingham, Dr. Gillingham. In contrast, women were much more likely to have positive general terms like delightful. They were also more likely to have what they consider grindstone words, like not talking about their abilities and their leaderships and their scholarship, but they're really hardworking. They were more likely to use physical descriptions and actually describe the women physically. They were more likely to have statements of doubt, where they would raise some doubt about the candidate's likelihood to be a great resident. And they talked about their work ethic. So for women, they're saying that we're lovely and we're hardworking and we have a good work ethic. Perhaps we're cute. And men, they're talking about how they're leaders and they're achieving and they have abilities. And like themes that came out were for the male medical student letters were around performance and career and leadership and knowledge, where themes that came out in the female medical students letters were how caring they were, how much time they took, they were patient oriented and supportive.